We work with the urban poor, enabling access to basic services and healthcare, empowering communities and ensuring provision of civic entitlements through advocacy. We have been primarily a Mumbai-based organization. It's only in the last month that we took our work to Ahmedabad, Jamshedpur and Jaipur in partnership with 3 organizations from these cities. In the coming years, we plan to further intensify our work around citizenship, entitlements and advocacy. With regard to a funding strategy needed to navigate the crises brought upon by the pandemic and the subsequent lockdowns, let me begin by saying that it was unprecedented for us as well. Apnalaya has never been a disaster relief organization. We knew very little about supply chain or anaj mandis. We responded to the situation as best as we could. In hindsight, however, we can say that we knew the people and the community we work with very well. And we were alive to the specific challenges they were facing because of the pandemic. We raised 7.1 crores in 2021 and 6.55 crores in this financial year. This was huge for us because till then our overall organizational budget has been about 5 crores. Today our budget is 13 CR plus, including the support for COVID relief. The first thing we did almost instantly was to reach out to our existing funders and explain to them the need to take up relief work. Within a month from 24th March, when the lockdown was imposed on the country, we had completed 1 round of relief distribution among over 11,000 households in the slums of Mumbai. This could happen because we knew that more than 46% of the slum dwellers in our intervention areas were daily wages, and with a monthly family income of 13,000, they would have no savings to cope with the sustained lockdown. Even before the pandemic, we knew that about 11% people severely lacked food security. In other words, we had research and data to back up our funding efforts. We did 1 rapid survey in April 2020 and 1 intensive needs assessment study in December 2020. We collected some data from every household even during the relief work. And this may be a small or an obvious thing, but I would still like to mention that we decided not to raise funds just for our beneficiaries, quote unquote. Our relief was never targeted. We covered all the households of every slum cluster we could reach out to. The entire relief work on the ground was carried out by the community people. They were not only compensated, we even convinced a philanthropist to buy health insurance for them. It would appear unthinkable today, but we were adamant. We could not have compromised the safety of the poor workers in order to help other poor in the community. Once we did it and talked about it, 5 organizations followed suit in Mumbai itself. Though we began with targeting institutional donors, we soon extended our focus on CSR and individual philanthropists, as we realized that in a sustained crisis like this, we needed more support from the private individuals and CSR. The institutional support went down from 64% in 2020 to 41% this year. In the CSR support, and the CSR support rose from 18% last year to 55% this year. We did one more thing that might have enhanced the traction towards Apnalaya. We started to talk about the urban poor in general, not just our beneficiaries, the missing data on migrant workers, the disenfranchisement of the poor in the city, policy loopholes in relief measures, the lopsided mainstream narrative which was initially limited to hand washing and physical distancing. We published 9 articles since March last year. We have had 54 media mentions, including 4 TV interviews, 1 with NDTV and BBC, 2 with Australia Broadcasting Corporations. We had a pretty decent social media presence. I think, considering that we have always been one-person comms team, but to be fair, our entire second line gave its best to mitigate the situation we were in. Every minute that became available due to the restricted program activities, we utilized it for speaking, writing, fundraising, and reaching relief to the people. Near real-time social media reporting on our relief work perhaps added to the elements of transparency and trust so crucial to fundraising. Today we have evidence that some philanthropists and corporates reached out to us because of our media interventions. Apnalaya initiated a consortium with 3 organizations which grew up to have 14 CSOs in almost no time and covered the entire Mumbai metropolitan region. Very soon, I think by August last year, people began to reach out to us to inquire about the situation in Mumbai. They of course must be talking to several other people as well, but the attention was quite significant for a small, low-profile organization like Apnalaya. Did it help us generating resources? Perhaps it did. When we see that about 60% of the 13 CR that we raised literally came to us, the funders approached us. We solicited funders only for the remaining 40% of the 13 crore that we raised. To sum it up, I think evidence, transparency, trust, agility, and brevity in thinking and acting helped us in a big way. Research and data, writing articles and undertaking media advocacy, not just for our intervention areas, but the urban poor as a whole. Initiating and nurturing a consortium and not just going about it all alone were critical to what we managed to do. In fact, recently we have taken it beyond providing the immediate relief to the urban poor. We have started helping urban poor because we have started helping urban poor procure basic documents so that their entitlements and government welfare become accessible to them. We call it a long-term relief measure. A couple of donors have already come forward to support Apnalaya in this work. That's all for now. Thank you.